Providing an improved health service to all 1.4 billion population in India is a great challenge. According to a United Nations study, 75% of specialist doctors and advanced health infrastructure are confined to urban areas where only 27% of the total population lives. 73% who live in rural areas don't get basic healthcare services. Many patients die before receiving proper diagnosis and treatment. Many patients in our country still depend on local quack practitioners or local pharmacies for primary health care. But we have a great resource of doctors. Today, there are a total of approx 90,000 MBBS seats in 612 medical colleges, both public and private. In my opinion, if these doctors are engaged fully at the service of people, with the help of modern technology, we can cope up this situation. So we should have some basic knowledge of EMR, that is the electronic medical record. Electronic medical record is an electronic version of medical information about a person that is stored on a computer. An electronic medical record includes information about a patient's health history such as diagnosis, medicines, tests, allergies, immunization and treatment plans. In brief, EMRs are digitalized version of medical paper charts of a patient's treatment. So let's discuss about benefits of electronic medical records. So fewer errors compared to paper records. E-prescription optimizing communication between doctor, patient, pharmacy in effective, direct and secure way. It saves time, improves patient care, contributes to the sustainability of the health system. Avoid unnecessary travel or visits to the clinic for the prescription or renewal of medications. E-prescription improves accuracy, enhances patient safety, quality of care, since there is no handwriting for the pharmacist to interpret or calling in prescriptions. Easy access to care and improved treatment and diagnosis. EMR makes access to care easy for patients. Often medical knowledge and information are too complicated to record and understand or remember. With regards to doctor's consultation, they may not be able to explain and divulge information with accuracy. However, with EMR, not only do patients have access to records, but doctors also have access to records, which help them offer better informed treatment regimens. EMR can help us to identify patients who require screenings and preventive care. With easy access to prescription reports and clinical advice, the patient is always motivated to monitor their progress and take adequate preventive measures to prevent worsening of health conditions by following the prescribed lifestyle. Receive follow-up support like reminders, web links and self-care suggestions. Patients can access their records, view digital prescriptions, follow recommended lifestyle changes. So EMR also helps clinics and doctors to save space. Clinics don't need to store, manage and retrieve paper records, thus saving space. Lower operational costs. They reduce the operational cost by keeping records in one place. Contact other medical facilities. Clinics can interface with laboratories, pharmacies and hospitals. Enables outreach. Clinics can gather patient data and analyze it. This accessibility helps doctors reach discrete populations, improving overall health. EMR have communication capabilities that let clinics and send reminders and alerts. Supports research. Documenting patient records digitally supports research and doctors can monitor patients for better care quality. EMR helps to check conflicting treatments. They have safeguards that prevent treatments they may conflict with each other. Communication between staff. They track messages between staff, hospitals, labs and other clinicians. Avoid duplicate tests. Without timely access to test results, physicians may have to order repeat tests. Keeping physicians up to date on previous tests reduces the need for repeats. It is especially important when tests are expensive, uncomfortable and invasive. As the world's healthcare system going digital, electronic medical records are going to be an important part of this system. EMR will be crucial to the future of Indian healthcare. Next, let's discuss about telemedicine. In broad terms, telemedicine refers to providing health services from a distance with the use of audio or video conference or both. Telemedicine aims to provide accessible, cost-effective, and high-quality healthcare services to individuals. Telemedicine is also referred to as telehealth, remote patient monitoring, and mobile health communication. Dr. Devi Shetty, a cardiac surgeon and the chairman of Narayan Hridayalaya, opines that in 99% of cases, the patient does not require an operation. So the doctor does not need to touch the patient or even be there physically. Since most decisions in healthcare management are based on history and interpretation of past cases, most of the problems can be managed by telemedicine. So what are the benefits of telemedicine? Access to specialists. There has always been a huge difference between the quality of healthcare available in urban areas and the one available in rural areas. With the use of telemedicine, we can connect specialist and super specialist doctors and provide remote healthcare in any place. Protection against infectious diseases. As there is no physical contact between the patient and the doctor, telemedicine eliminates the possibility of transmission of infectious disease between patients and doctors. Overcoming poor infrastructure. Telemedicine allows access to high quality healthcare without building enormous and costly medical facilities. It allows consultation with specialists because it is not hindered by location. It also helps rural residents to save money or travel expenses. Comfort and hassle free. It enables the patient to access the healthcare without leaving the comfort of the home and allows doctors to remotely visit the patients without being present at the clinic. Time saving. Many times patients are not coming in clinic due to their busy schedule. They are coming when the disease gets worse. So telemedicine is an alternate way of getting doctor consultation as per their convenience. Family connections. Patient can get support from family members during some serious health issues consultation. Primary care and chronic conditions management. Chronic conditions like diabetes easily can be managed by regular telemedicine follow-up. Promote quality healthcare in remote villages. With the help of telemedicine, we can provide better healthcare services in remote villages. Next, we will discuss regarding teleradiology. This is the workflow of teleradiology, how it works. Teleradiology is a branch of telemedicine in which telecommunication systems are used to transmit radiological images from one location to another. Interpretation of all non-invasive imaging studies such as digitalized X-ray, CT, MRI, ultrasound and nuclear medicine studies can be carried out in such a manner. Teleradiology can happen in multiple and sequential steps which are capturing the medical images through a radiology modality. When a patient goes to the radiology department or a private radiology center with a prescription of the required scan, the patient should be well qualified before performing the scan to get the best possible images to facilitate the work of the radiologist, which is giving the right diagnosis and report. After qualifying the patient, the radiographer will be responsible for capturing the images of the required scan, and according to the standard procedures of this scan, these images can be of multiple radiology techniques like using X-rays, CT scans, MRI scans, PET-CT, mammography or any other type of imaging studies. Second step is storing the medical imaging studies on a PACS system. In the modern radiology modalities that support DICOM functions, it can generate digital medical images in DICOM format, which is primarily temporarily stored in the local workstation related to the radiology modality. Through a network communication, the radiology modality workstation can push the patient study to a picture archiving and communication system to achieve the medical images with patient information. Third step is forwarding the medical imaging studies to external specialists for a diagnosis and reporting. A hospital or a private radiology center can contract with a radiology consultant who is not hired full time inside the facility itself. The consultant can be from anywhere, maybe from another city or from another country. The distant radiology consultant is notified with the new patient studies to start accessing the PACS system through the internet with special credential to start investigating the images and writing the patient report regarding these images. And fourth step is radiology department get patient report. After the consultant radiologist investigates the patient study, writes and validates the diagnosis in the form of a report on PACS system, the report is delivered to the patient or the referring physician to take the right action. So what are the advantage of teleradiology? Teleradiology achieves better access to care. Teleradiology supports doctors in caring for patients by providing them with an accurate diagnosis, optimal patient care, treatment without being forced to be with the patient in the same place. Since most radiologists are located in the urban areas only, such as the teleradiology service or what is known teleradiology is a distinguished step and the only lifeboat for patients, especially the elderly or those who live in suburban areas far from health centers, hospitals and medical clinics. Teleradiology drives better patient outcome. Teleradiology helps in getting faster reports as it eliminates the boundaries of physical existence of radiologists inside the healthcare facility. Radiology has become a critical service for healthcare delivery as a lot of decisions depend on the radio imaging scans to discover what's wrong with the internal organs of the body without any physical intervention. It's not just getting a fast report, it's about a quality report. So getting a report from a highly professional radiologist is very important to get the most precise diagnosis of the study. Teleradiology allows this to happen so you can reach the best calibers all over the world without the need to hire them in a full-time job. Teleradiology helps for getting a second opinion from experts. Teleradiology can also be used in the process of remote consultation, especially when the supervising doctor is in urgent need of a second professional or specialist opinion to confirm a diagnosis or treatment by transmitting X-rays, magnetic resonance imaging, etc. To another radiologist is located in a remote location so that he in turn diagnoses her from his own perspective and gives his opinion according to his experience, skills and expertise in radiology. With this service, patients no longer have to travel long distances to obtain an accurate diagnosis of their images or health condition. It saves time and effort. In many areas of our country, the delivery time of medical imaging reports might take up to 1 to 2 weeks due to the lack of professional workforce in the field of radiology, which makes it harder to cover medical imaging services in all healthcare facilities at once. Radiologists might have to travel for long distances to suburban areas to report patient studies, and this makes it a slower process that takes much time, which is a big advantage of teleradiology. So, teleradiology is cost for healthcare facilities. The coverage of radiologists in a healthcare facility using the hiring strategy cost healthcare facilities a lot of money to get the high level of expertise required to give a good quality reporting service. So, teleradiology solves the problem of achieving the continuum care 24/7 and hiring a lot of radiologists which is not achievable due to the limitations in the available resources. By using teleradiology services, you can get your service on demand, which is more convenient, cost efficient for healthcare facilities as the service is highly available at lower cost. Next, we will discuss artificial intelligence in healthcare sector. AI is the future of upcoming decade. We can see nowadays a lot of its applications like Siri, Cortana, OK Google, autonomous cars and robots. All applications of AI is meant to make human life easier and better. Despite the fact the artificial intelligence invokes fear and most of us it is benefiting us in numerous ways. Application of AI this time is still on a narrow scope that includes simple tasks, but in the future AI will be stronger at all cognitive tasks. To understand what exactly is artificial intelligence in a simple way, artificial intelligence is the development of computer systems that are capable of performing tasks that normally require human intelligence, tasks such as decision making, object detection, solving complex problems and so. So now let's move on and understand two of the most important topics in artificial intelligence, which are machine learning and deep learning. We will try to define it in a simple way to differentiate between them, as many people don't know what exactly the difference is. Machine learning is a subset of artificial intelligence which provides machines the ability to learn automatically and improve from experience without being explicitly programmed to do so. In simple terms, machine learning is the process of filling machines with lots and lots of data so that they can interpret, process, analyze data in order to produce any actionable insights that benefit an organization. Basically, deep learning is a more advanced field of machine learning that uses the concept of neural networks in order to solve more complex problems that require high dimensional data and automated feature extraction. The neural networks, in a nutshell, are what the human brain is formed of. Scientists basically repeated our brain in the form of artificial neural networks or also deep learning. So let's discuss benefits of artificial intelligence. Better quality and precision. The possibility of human errors is relatively variable due to the continuous change of humans' physical, emotional, and mental status. So the high performance and proper decision of human, even if they are very skilled, are not guaranteed all the time. And in AI, decision and actions are made according to previously collected datasets and applying specific algorithms on them in a consistent way that minimize the potentiality of error in the process every time. With more learning, the AI becomes more accurate, always developing. Many applications of AI help humans minimize the potential error. AI saves time. Using artificial intelligence can help to make faster decisions than humans. It can solve complex problems and perform high level computation that will take days for a human to solve. It does not take a lot of thinking and spending much time in analysis. It executes exactly what they are requested to do without consideration of all human factors. Also, AI is capable of doing routine and repetitive tasks what can take much time. It would have humans' time spent on regular tasks and make them available to the necessary tasks that require human intervention. AI is working all day long without breaks or vacations. One of the most fantastic feature of AI, it doesn't have stamina or working hours. Humans are working for a specific period of the day and they have vacations on holidays, which is not in the case of AI. AI can work continuously without interruption or breaks 24 by 7. It can perform tasks all day long that increase productivity and efficiency as well. AI keeps human safety. AI is now capable to take risky tasks which humans cannot take. It is considered one of the most important benefits of AI to replace human by robots in the risky work. So now let's see most popular application of AI in healthcare industry. AI in medical imaging. One of the most powerful application of artificial intelligence in medical diagnosis now is in medical imaging and diagnosis powered by AI because of the huge digital data produced by imaging modalities. Also, the shortage of radiologists and the rising imaging technology caused increased workloads and delays in reporting, which pushed forward the need for new technology to support radiologists and empower them. With the help of convolutional neural networks and machine learning algorithms, the AI powered PACS system can read medical images of several types like X rays, mammogram, CT scan, and MRI scans. AI is trained on a large number of datasets to detect lesions, other abnormalities in images, and differentiate between normal findings and other abnormal scans. AI is capable of recognizing medical images and detecting multiple diseases with precision. It can detect even the smallest abnormalities in images that the normal eye cannot detect. So, AI in early detection of diseases and critical events. Now, let's understand how artificial intelligence has helped in detecting diseases at an earlier stage. Actually, artificial intelligence has played a very important role in the early prediction of medical conditions such as heart attacks. There are many AI-based wearables health trackers that are being developed to monitor the health of a person and display any warnings when the device captures something unusual or something unlikely. Examples of such variables include Fitbit, Fitbit, Apple Watch, and many others. Precaution is always better than cure. I think this was a motto behind the latest release of the Apple Watch. Apple used artificial intelligence in order to build a watch that monitors an individual's health. This watch is basically collect the data like the person's heart rate, sleep cycles, breathing rate, activity level, blood pressure, and so on. It keeps a record of all these measures 24/7. So all you have to do is to wear the watch. All of this data is automatically collected by the watch. So now that you have collected data, you know the next step in machine learning is processing, analyzing, and making predictions from data. This collected data is processed and it's analyzed using machine learning and deep learning algorithms so that you can build a model that predicts the risk of a heart attack. With the help of data, you are going to predict whether a person has chances of getting a heart attack or not. Next, we will discuss AI in pharmaceutical sector. For many years, the pharmaceutical industry is dependent on using the latest technology that would help in the delivery of the best drug formula to be safe and efficient. Pharmaceutical industry is now making a good use of artificial intelligence in many functions, starting with drug discovery and clinical trials till the manufacturing process and marketing. In the field of drug design, AI helps in identifying complex patterns in diseases, its behavior, so it can recognize which chemical composition that can be effective in treatment of a specific disease. AI can improve success rates in clinical trials and helps in lowering the cost of innovative which interpret why AI is rapidly adopted in the pharmaceutical industry. In the field of clinical trials, it helps in identifying the best candidates for clinical trials based on a large number of patients with a specific conditions. It can scan all patients' history and the disease stage for every patient in addition to other parameters and make a decision for choosing the right patients. In the manufacturing process, AI can improve productivity and efficiency by replacing the conventional manufacturing techniques with enhanced techniques that positively affect quality control, waste, and preventive maintenance. Now let's move on and understand how artificial intelligence is used as a virtual medical assistant for healthcare providers. This is a new innovation of AI in healthcare to help physicians alleviate the daily pressure of workflow as care practitioners are suffering from burnout because of the increasing number of patients and high workloads. The increasing number of aging population with chronic conditions and the shortage of professionals urge the importance to find a solution that helps physicians and care providers to skip the daily routine work. AI contributed to developing machine learning powered solution like a transcription and conversation between patients and physicians without the need to manually record information. This virtual medical assistant can provide a fully transcribed conversation with technical notes that only needs a revision and signature from a doctor. Then it can be integrated to the electronic health record of the patient. For health radiologists to streamline their workflow and accelerate the diverting their advice and unstructured data formatted and developed save tasks for them. Now let's move on and discuss artificial intelligence in making. AI has played a very important role in making in the field of healthcare. The clinical decision support the product of big data with intelligence, the medical generated from electronic record, variables, sensors, it might make good use of. Gathering information, it can compare the patient history, the current status, give recommendations for the best practice and better care coverage. Give disease support according to complications. CDS enables risk rating and make more precise patient status. It will continue evolving with and provide more capabilities. Discuss AI in virtual nursing and symptom assessment. Innovative application of AI in healthcare is extending to personal health check. We have started to see mobile apps and websites that allow people to check their health status or they want to get a pre-diagnostic assessment to their symptom before they visit a hospital or a clinic. These applications help people to enter data of their symptoms through chatbots to discover what would be the cause of these symptoms. For sure, it's not a replacement for a doctor, but this can decrease the burden on medical staff, can give a primary vision of the case that needs further assessment by the doctor. This would be beneficial also in providing healthcare professionals a primary report about the case, especially when using telehealth consultation to save physicians time and make them focused on to drive better productivity. This tool can provide medical trials to let patients know how severe their case is by classifying their cases according to multiple categories like life-threatening, priority or non-urgent cases that needs ordinary treatment and care pathway. One of the most application of this tool is providing a COVID-19 symptom checker that allows the patient to check their symptoms if it is potential to be COVID or not. The good thing about it, it is its availability 24 by 7 and it can give patients some guidance and recommendation regarding their condition and what is the most suitable care pathway for them. Next interesting thing is AI in remote patient monitoring. AI can help improve patient outcomes, support physicians in remote patient monitoring and save their time to give attention to patients who truly need their care. Medical wearables and sensor can measure and monitor patient vital signs and other medical data automatically, then analyze this data. AI can send recommendation to doctors based on data analysis for patients who need to be checked. Applying this technology helps a lot in reducing the cost of care and unnecessary readmission by patients, especially with the growing aging population. We should get ready with a new mindset to accommodate all AI healthcare applications that will transform our lives in the current decade. Now I will discuss the role of technology in clinic management. So first we will discuss smart queue management and live tracking. Currently, we are facing long queue and crowding at hospital reception. Insufficient receptionists to accommodate large number of patients, annoyance caused by the patient's inability to know how long to wait. We can overcome this situation by implementing smart queue management and live tracking. So benefits of smart queue management system. Queues have always posed a problem for clinic and hospitals. The question is how we can manage high patient numbers while all making the queuing process as smooth as possible. Smart queue management solve this problem and bring efficiency to the queue process. Here are some benefits to using smart queue management technology. Reduce wait times. The standard benefit of a smart queue management system is that it makes the queuing process more efficient. This reduces waiting time for patients and allows you to serve them more quickly and effectively. With the implementation of live tracking, patient can check their status of their serial from their home from their smartphone. Increase workforce efficiency. A smart queues management system allows a hospital to see where its insufficiencies lie. As a result, managers are able to effectively divert employees to where they are needed most. By directing employee efficiently, customers are more effectively served and productivity is increased. Cost savings. Queue management is able to reduce cost for hiring more employees in the reception area. Increased employee satisfaction. The ability for businesses to be able for direct employees effectively means that they are better managed and equipped to handle each situation. By being more prepared, employees can fulfill their role, which reduces stress and increases their satisfaction in the job as they feel more supported when clear data driven instructions. Increased patient satisfaction. Patient satisfaction is boosted through the use of queue management and live tracking. Not only are queue times reduced through smart system, but patients can also be prompted more effectively through tab-based check-in or walk-in appointment, bringing them up-to-date information or instruction to ease the service process. Reduce patient loss. Linked to both improve patient satisfaction and reduce queue times, smart queue management also helps to reduce patient loss. Patients that are in shorter queue and kept informed about the length of the time that they will be waiting are much more likely to stay. Increased hospital agility. Smart queuing technology also means that managers and hospitals are able to see bottlenecks in real time. This means that they are able to react quickly and direct staff and resources to combat issues before they escalate, improving the service they provide. Power of data. Hospitals are able to use data from smart queuing system to prepare for peaks and troughs by mapping out exactly when a premise will be busy. Hospital managers are able to allocate resources effectively. COVID conscious technology. A smart queue system that gives patients the ability to pre-book appointments or use tab-based walk-in appointment to remain COVID safe. A clinic using this technology can control the number of people on site at any one time, which means they are able to maintain social distancing and help to halt the spread of the infection. Next, we can use kiosk-based self-service in walk-in or check-in, self-billing, payment collection, report printing, vital checking, and teleservices. So, benefits of kiosk. Healthcare kiosk streamline the patient check-in. Whenever the telehealth kiosk is installed, such as in hospitals and clinics, the patient could finish self-registration at the first time. The login mode could be QR code-based card, which includes personal information such as email, mobile number, or more field can be customized. Offering patient check-in, kiosks give people control over their own registration process, ensuring less errors in recorded personal information, providing easy means to pay bills at the kiosk. Streamlining these procedures frees front desk staff from data entry and allows them to focus on other tasks like scheduling or answering the questions. Delegating more control over the check-in process to the patient ensure hospital or clinic staff can concentrate on what's most important, providing top medical care. Minimize the human-to-human contact. Medical check-in kiosks can provide an important solution to the goal of maintenance proper social distancing. When a patient can check in at a self-service kiosk, counter staff no longer risk being exposed to germs from sick individuals. Additionally, healthcare kiosks are easily disinfected. Expect a solid future for telemedicine kiosks. As hospitals and clinics concentrate on keeping non-emergent illness out of the facilities in order to make room for more critical cases, the use of telehealth options has increased. With that, people are gaining a greater comfort level using alternative healthcare methods to communicate with a physician. Telemedicine healthcare kiosks can also provide convenience to places with the immune compromised or elderly individuals like group homes, assisted living care facilities. These telehealth kiosks can provide on-site care easily and efficiently, reducing the need to risk exposure at a clinic or make travel arrangements for seniors to visit the doctor. So, medical kiosk is a medical level checkup station for people to have complete body health screenings. In the traditional hospitals or clinics, people need to go to different places to take different health examination before seeing a medical doctor, which is quite troublesome and time consuming. While medical diagnosis kiosk combines vital signs plus chronic disease checkup at one station, all the patient's health results can be stored or transferred online. So it is the most convenient for telemedicine services no matter where the patient are. Multiple health screening at one station. It includes height, weight, BMI, body fat percentage, basal metabolism, body score, ECG, glucose, uric acid, HbA1c, urine, blood pressure, SpO2, temperature, otoscope, stethoscope, psychological test, hematology analysis, ultrasound scan, etc. Indeed, the health checkup kiosk is like a medical platform which can do lots of health examination at one station without asking people to go to everywhere to process the measurements. Communication with electronic medical record. The personal health results could be stored and connected with hospital information system. Thus, the doctors can understand his health condition and provide diagnosis accordingly. Next, we will discuss online doctor appointment booking system. An online doctor appointment booking system can prove to be a boon to doctors and patients alike. For those among us who have seen the waiting room of busy doctors, it will draw memories of patients and their attendants crowding around the receptionist. The wait could be quite long, and if the patient was not quick to mark her presence when called out, it could mean a further wait. Patients being sick, there was always a high probability of the attendants also falling sick, as everyone is crowding around each other. This evolved to a telephone-based appointment booking, mainly managed on paper. It was hardly flexible. With the advent of personal computers, appointments were maintained in the desktop. This certainly brought more order. However, appointments still required the patient to phone into the receptionist to book the appointment. Widespread use of mobile phones and the internet has driven the need for doctors to offer the facility of online appointments booking, a far superior option for both doctors and patients. In this techno-oriented world, individuals with diverse psychologies will choose to schedule their appointment before going to the place, whether it is a doctor, salon, to save money and time. The key advantage of using an online doctor appointment booking system are 24/7 booking anytime, anywhere. A manual system to manage appointments necessarily requires the availability of a receptionist or office staff. A doctor appointment booking system available on the internet allows patients to book an appointment from the comfort of their homes using their computer, laptop or mobile. And at any time, no matter where they are, they can contact doctors of their choice in any location. Even when they are traveling, they can consult with their doctor. Doctors can also adopt technology in the form of teleconsulting to reach out to patients in remote corners. It's true outreach. Doctors can organize their schedule better. Imagine a situation where multiple appointments are queued up because of manual error. As a doctor, you control the number of people who would be at your clinic at any point of time. This is particularly important given that social distancing is becoming the new normal. With an online appointment booking system, the doctor is full control, can plan his or day without any sense of anxiety or fear. Minimize the patient missed bookings. One of the biggest challenges of a manual or telephone based appointment booking system are patient missed bookings. Patient may simply forget their appointment. Given that there are no automated reminders, a doctor appointment booking system can be configured to send reminders to patients prior to the time of their appointment, making employees and staff more productive. A doctor appointment booking system is a self-service tool for patients to book appointments. Your staff have their time released from handling phone calls from patients desiring appointments. Instead, they can focus on their task and improve their productivity. Seamlessly integrate with your EMR. The appointment booking system should integrate well with your EMR. Doctor should be able to see the list of appointments at any time, in addition to knowing the status of the appointment in time, of whether the patient has arrived, whether her vitals have been measured. Access appointments on your computer, laptop and mobile phone. As a doctor, you can access the patient information on any device. You should have the ability to reschedule or cancel appointments in the event of any emergency. The online appointment system that is hosted on the cloud can give you all the appointment details at any day in the past, today or in the future. Improves patient satisfaction. Patient experience is of paramount importance. No patient would like an experience that is not smooth. An online doctor appointment system enhances the patient satisfaction. Patients no longer have to be worried about the wait times in your clinic. They can plan their daily schedule better. They spend less time waiting to meet the doctor. All this goes a long way to enhance patient satisfaction. Integration with a payment gateway. The online doctor appointment booking system can be integrated with a payment gateway of your choice. This means less work for your staff in terms of collecting payments. Instead, all fees can be collected prior to the appointment. Multiple locations and multiple doctors. A good online doctor appointment booking system can manage multiple locations, multiple doctors. Clinic may be operational in multiple places and each clinic may have multiple doctors, each of who is available in a particular time slot. Does your system have the capability to managing these complexities? There should also be no requirement to have multiple staff to manage all this. Instead of system should manage multiple locations and doctors. Patients are increasingly looking at convenient ways to book appointments. They prefer to use options available on their mobile or laptop to book appointments. An online doctor booking appointment system that integrates seamlessly with an EMR is ideal for doctors as well. It reduces fatigue and frustration. Adopting digital technology involving the use of appropriate tool is recommended for doctors. The pandemic has made sure that digital modes are embraced even by the sections of society that was either hesitant earlier or had limited access to the internet or such tools. Patients are also likely to be more welcoming of these tools. Having a presence on the internet is a starting point. Having a convenient appointment system using which patients can reach you is the next step. Every doctor should adopt digital tools, lest they be left behind. Now I will discuss about how to manage large volume calls efficiently by IVR, that is the interactive voice response system. So benefits of IVR, it automates the simple processes. Some things do not need exclusive attention. There are many such things that can be easily taken care of with the help of an IVR system. Information such as the location of a clinic or information about clinic and doctor retrieved from an IVR system, simplifying the efforts of your staff as well as all your patients. An IVR system automate simple processes so that your staff can focus on more important tasks at hand. 24/7 assistance. As much as we would like our staff to always be there for our patients, it is not very practical. There may be times when staffs are taking a break or on leaves, such are the times when an IVR system solves basic queries of patients so that they don't have to wait on staffs. If there is a situation that demands the intervention of staff, the patients are given a choice of dropping a message notifying the necessary support staff of the required assistance. The 24/7 availability of an IVR simplifies the work of staffs and ensures uninterrupted services for the patients. Reduce overhead costs. Hiring a bigger staff and maintaining them can be a major task, especially if your clinic is growing and is it in its initial phases. So prioritize your calls, avoid marketing calls. There are some things that are more important than others. There will be times when your call inflows would be so high that you would not be able to manage it and your staff will get overwhelmed. At such times, focusing your resources in the right direction is crucial. An IVR helps route your high priority patients to the right support staff without delay. This will help you give your valuable patient the attention that they deserve. So route it to the right staff. When calls are routed to the wrong department, it can add to the frustration of both the staffs and the patients. When a call is routed to the staff who does not specialize in that particular subject, it ends up pointlessly consuming their time. This distracts them from the work that they are assigned to do, and as a result, it can significantly decrease the productivity of the staff. Feedback. Continuous improvement, no matter where you stand, is the only way to grow and become more successful. Receiving proper feedback can make a huge impact and improve the overall productivity of your organization. So billing systems in a hospital or clinic automate the manual task of billing to ensure faster payment. This benefits providers by making the processing faster, improving workflows and tracking patient information. Billing system in hospitals have transformed over the past few decades from a manual paper-based medical billing and coding process to complete automation. Providers benefit from the hospital billing system. Next, we will discuss customer relationship management. So what is it? Customer relationship management is a process in which a business or other organization administers its interpretation with customers, typically using data analysis to study large amounts of information. CRM system compile the data from a range of different communication channels, including a company's website, telephone, email, live chat, marketing materials, and more recently, social media. They allow businesses to learn more about their target audiences, how to best cater for their needs, thus retaining patients and driving growth. So what are the benefits of CRM? Improve patient satisfaction, develop loyalty and bring them back to the facility in case the need so arises. Store basic data, store every patient basic information and contact details in one place. Add family members, contacts, birthdays and auto send wishes to your patients. Digitalize patient records. Within each patient's profile is their calendar that lets you see checkup dates, due and other important days with the patient. It reduces the data entry mistakes, abollishes your filling needs, reminds your staff of the pending task and reduces your manpower of the requirements. Improved communication. The software allows monitoring of the important interaction between care providers, patients and vendors to reduce miscommunication at all levels. Allows your patients to communicate with you easily through any channel of their preference. Follow-up call, reminder call, filter which patients are critical or not responding to treatment. Retention survey and feedback can be managed by CRM very well. So next we will discuss AI based chat system. So provided, what are the uses of AI based chat system? First is the providing informational support, like basic informational support of their patients like doctor information, clinic location can be given by chatbots. Anytime users can ask chatbots about a clinic address, telephone numbers, visiting hours, etc. without disturbing support personnel and conducting time consuming searches on the patient portal. Next, scheduling appointments. The chatbot technology can make the process of appointment scheduling as quick and convenient as possible for patients. To make an appointment with a doctor, patients select available dates and time slots with the bot and confirm their choice. Patients can make an appointment with an available doctor right when the first symptoms appear. As for healthcare organization, using chatbots for scheduling, they can reduce the staff's workload and eliminate the possibility of overbooking due to a human error. Collecting patient information for caregivers. Chatbots can make huge difference by collecting patient information such as name, address and symptoms. A symptom checker chatbot can help medical staff monitor patient state and perform diagnostic procedures, while collecting patient personal info can facilitate, or for example, patient admission activities. Providing medical assistance to patients. Chatbots can help patients manage their own care and increase their engagement in the treatment process. Chatbots can become a personal nurse for patients, reminding them to take medications, controlling their diet, or even providing a short consultation on their symptoms when integrated with a medical database. Also, if a chatbot is connected to a wearable device, it can use collected information to advise patients on certain actions or notify a doctor in case of for an emergency. For example, healthcare chatbot is integrated with a wearable glucometer. It can automatically suggest a user inject insulin or call a doctor if an abnormal blood sugar level is detected. It frees up healthcare providers resources and speeds up the process of getting medical help. Assistance in prescription refilling. Chatbots can become a feature of telehealth app and be used for remote prescription refilling and renewal. So I believe that the chatbots technology had great potential. It is an integral part of the effective healthcare industry. Still, the development and implementation of healthcare chatbots can be a complicated task that demands expertise in various technological aspects, including AI, natural language processing, in particular cyber security, etc. Now we will discuss QR code based health card facility. Most people usually keep their healthcare information in the form of paper, but very often they misplace those papers or the papers get damaged over time. This can create a lot of problems, especially during the time of a healthcare emergency. But if everything is stored digitally, then candidates can easily carry their health related information to anywhere conveniently. Moreover, with digital system, there will be very little chance of getting misplaced. Hence, these digital health ID cards are beneficial for everyone. A digital card holder can see all the details of the health card services and doctors. You will find all the details of your treatment, discharge, every test that you have conducted. This beneficial online tool will portray all the record that you need when you visit any professional hospital. If you give a medical practitioner your cardholder ID, he or she can access your medical record at any time and will suggest the best treatment. So, with the help of technology, we can use medicine home delivery apps, order medicine. Customers or patients can register to the app to search for medicines and place an order for the doorstep delivery in a few taps. Customers can upload their doctor prescription on the app, can store them on cloud to access whenever they want. Once the order is successfully placed, user will receive real-time alerts for the order status, can even track delivery on maps. Customer can easily pay for their orders using most preferred methods by integrated payment gateways. So this is all about technology. Now we will discuss the role of communication in healthcare. Skillful communication enables doctors to establish rapport with their patients solicit the crucial health information, and work effectively with all members of a care team and the public. So, what are the barriers in communication in healthcare? Communication is foundational to all layers of the healthcare system, but it is often problematic. Fortunately, professionals in this field can take steps to overcome many common barriers to effective communication in healthcare. First barrier is patient distrust and discomfort. At the patient doctor level, patients may not feel comfortable disclosing sensitive information such as substance misuse or sexual dysfunction to their doctors. Patients withhold medical information for many reasons. They feel frightened by their doctor. They believe their doctor would not listen to them. They feel disrespected by the request to disclose. They struggle with physical or psychological trauma. Second barrier is common language barriers. Patients often have difficulty communicating needs or symptoms when the doctor does not speak their language, when the healthcare organization has not supplied an interpreter. Healthcare organizations that don't prioritize culturally competent care, including the use of interpreters to bridge communication gap between patients and doctors, fall short in delivering adequate support to their communities. Third barrier is doctor rush attitude for next appointment. A packed clinical workday often requires doctors to rush from appointment to appointment, resulting in conditions in which communication can easily get lost in the middle of conversation. Doctors who signal disinterest or distraction when talking with patients may lose the goodwill and trust of the very people they seek to help. Fortunately, evidence-based strategies for communication in healthcare can keep communication streamlined. Even a few extra minutes of communication can result in more efficient healthcare delivery for all. So, why is communication important in healthcare? Healthcare providers should understand that effective communication in healthcare organizations starts with recognize the importance of listening to one another. Skillful communication is essential to healthcare. Clear, honest communication between patient and doctor paves the way for accurate diagnosis and treatment decisions. Doctor can help patients feel heard, ease their fears, and encourage them to disclose relevant information. For example, a patient who feels embarrassed about a pubic rash will likely feel more safe mentioning this to a doctor who they know how will treat them with compassion and professional manner. In addition, every person deserves to understand the medical care they deserve so that patients can give their informed consent to treatment. To next discuss strategies for effective health communication. To overcome the many barriers to effective health communication, consider the following recommendations. Sit down and be humble. Studies show that when a patient and their doctor are seated during clinic visits and hospital check-ins, the two parties can build trust more easily. When a doctor sits down to talk with a patient, the patient perceives the visit to be longer and more intimate. This can quell patient anxiety about the communication. Ask open-ended questions. Patients often feel uncomfortable voicing their concerns even after a few minutes of empathic conversation. Doctors and other care providers should ask whether patients have more to say. Ask patients some variation. Is there something else you would like to talk about today? Doing so can create space for patients to reflect and voice concern they might not have mentioned otherwise. The BETH technique guides providers to ask patient questions that solicit more information and develop rapport. Before background, ask a patient about their present situation. What is going on in your life? Affect. A for affect, ask your patient how they are emotionally relating to their health concern. How is it affecting you? T for travel, ask your patient about what they are worried about or what they foresee as obstacles. What troubles you most about the situation? H for handling, ask your patient about how they are dealing with their situation. How have you been handling this so far? Empathy, so patients you are listening, reflecting back what you hear them saying about their feelings. Communication in health care gets easier when we all ask questions and prepare to listen. Speak in plain language. Doctors should avoid medical terms where possible and instead rely on plain language to communicate with patients. Where medical term is appropriate, doctors should always define the medical language clearly, such as this stethoscope is a device for measuring the heartbeat. Speaking in plain language communicates to patients that doctors care about having a two-way conversation with them rather than just delivering a monologue. Keep communications confidential. An entire hospital wing may be able to access to patient's file, but that does not mean they should. Limit access to individual case files to only the members of the patient's care team. Refrain from casual discussion of patient issues with anyone outside the team. Hire interpreters and culturally competent staff at every level. Healthcare settings should be safe places for people who need treatment, not environment that tolerate racism or other forms of discrimination. Healthcare organizations should hire interpreters as needed to ensure that all patients can communicate effectively. For every patient, hearing and being heard by the healthcare providers is a basic right essential to culturally competent and effective treatment. Interpreters help ensure healthcare organizations recognize and fulfill this right. From the above knowledge of the technology and communication, we can develop better healthcare infrastructure. We can develop health maintenance organization with the use of technology and proper doctor to doctor communication. Today, many patients visit specialist or super specialist doctor randomly as per their symptoms. If any mild burning chest pain, they are going to cardiologist directly. When they visit cardiologist, all the tests done to detect any cardiac abnormality. When no abnormality found, cardiologist refer the patient gastroenterologist. Here again all tests done like ultrasonography, endoscopy and no abnormality detected. The person was suffering from mild gastritis. He needs diet and lifestyle modifications only. So we need proper organized health structure where all patients will be filtered by primary care physicians. The PCP in short form will diagnose the case with minimum investigations and consult with specialist and super specialist through telemedicine if needed. It focuses on and coordinated care by a primary care physician. The PCP coordinates with in-network specialists, so patients must receive a PCP's referral to see any specialist. So let's discuss the purpose and benefits of HMO. What is the purpose of a health maintenance organization? The purpose of health maintenance organization is to focus on overall patient wellness and preventive healthcare while keeping costs low. So benefits: better healthcare facility at affordable price, no unnecessary referral to specialists, fewer medicines to manage health issues, proper health management system by digital healthcare system. Next, we can develop mobile health clinic. The majority of the population in India is dependent on public and private hospitals, and as such, these facilities can be overstretched. You also want to keep in mind that some areas are remote and the people living there have a hard time accessing the medical care. In recent times, people are encouraged to avoid public places due to COVID-19, and as you are aware, hospitals are public places where people can easily catch infections. Mobile clinics offer an instant solution when it comes to providing affordable and quality healthcare all around the country. Before we get into the benefit, let us define what a mobile clinic is. This is essentially a constructed occupational or storage unit that moves and is ideal for reaching people in remote areas. Such clinics also come in handy when healthcare workers go to work sites to offer prevention and medical services to workers. It is important to note that mobile clinics are custom made to serve specific purposes and to also overcome time and money barriers. Simply put, these cabins are equipped with all the necessary supplies that may be required on the road. So here are some of the advantages that are able to gain from using mobile clinics. Cost effectiveness. Owing to the current global pandemic, healthcare systems are likely to collapse because of the understaffing and overburden. Most countries are not prepared for a healthcare disaster, but we also cannot overlook the fact that if there is a lot of pressure on hospitals to serve the overwhelming number of people who need medical attention currently, mobile clinics act as a medical saviors in that they can reduce the number of times the people make trips to the emergency units of hospitals. According to a report, non-emergency visits to the emergency department could have been reduced by 40% if they had been handled by primary care physicians. Quality healthcare. You may be tempted to think that medical services provided from a moving cabin are substandard, but nothing could be further from the truth. These portable clinics operate under the same rules and regulations as traditional hospitals. Such clinics have to undergo extra audit procedures from the health department, making them more reliable. Of course, they may not be able to accommodate all the machines required in the medical field, but they come with qualified health practitioners who offer quality services. Third is the greater accessibility. Owing to the kind of innovative technology that mobile healthcare facilities have, they can deliver medical care on demand. This includes areas like urology, orthopedics, ophthalmology, and X-rays. Early diagnosis of medical condition can stop the spread of disease, especially those associated with lifestyle choices or are communicable. People will go for screening of various diseases if they know that it is done close to their home. Mobility also provides more efficient communication in healthcare. The agility provided by mobile clinics not only helps the patient with them early diagnosis but also improve the communication between doctors and patients. All inclusive care. As previously mentioned, most people will disregard mobile clinics simply because they believe they are not well equipped. However, these moving hospitals can be used to deliver the same services than actual hospitals. Those who use mobile clinic services get comprehensive primary health care such as testing, consultation and treatment without having to be referred to other hospitals. Convenient locations. Mobile clinics are all about ensuring that more people have access to both diagnostic and primary health care closer to their location. This offers a great way of ensuring that even people in remote areas get to access quality healthcare services. Providing inexpensive healthcare at public level can turn out to be a difficult endeavor. This is particularly true for people living far away from civilization. Mobile clinics offer a great solution to a double-edged issue. For one, the infrastructure of the clinics can be used by several communities, thus cutting costs. Moreover, these units take healthcare to those who need to regardless of where they reside. So mobile clinics are commissioned to provide health services to people everywhere around the country regardless of how remote. As such, the government and health practitioners need to work together to ensure that more of these are in operation. So in this way we can develop better healthcare system using the technology and communication and utilize the existing resources to deliver better healthcare services to large population of India. So let's unite together, let's build a better health network. Not only doctors, all the nursing staff, caregivers, volunteers from different places are welcome to join. As a founder of MedConnectPlus, I already built up the structure and experimentally opened 3 clinics in Murshidabad and 1 in Malda in 2018. Within 4 years, we have received overwhelming response from public and public wants more such digital clinic in their location. I request all the health professionals to join MedConnectPlus. Thank you.